One big issue in global awareness today is the ability to have access to affordable healthcare, which can be defined by the ability to afford and have access to the best health services for the best possible health outcomes. It doesn't sound like a crazy concept, but we still have billions of people worldwide without access to healthcare, and about 20% of the world's population is either in poverty or pushed farther into it because of out of pocket healthcare expenses. This not only affects their finances, but also their health, as they could be living with very preventable illnesses that can't be cured because they can't get the help they need because they can't afford it. A couple areas where this is very prevalent alongside the US is Africa and parts of Asia, where about 97% of the people that live in poverty in these continents is because out of pocket healthcare expenses. And on average, about 30% of their annual income goes to healthcare expenses. And this specifically affects a lot more women, specifically pregnant women and children, because I know a lot of countries in Africa don't have the facilities or electricity to run machines for successful birth. So this can lead to some complications for the not only the mother but the child. And a couple other areas of effects is like Latin America and Europe, which on average about 10% of their annual income goes to healthcare expenses. One solution to this is like the addition of universal healthcare, which was in the works before COVID happened, and it allows people to get access to healthcare when they need it and without financial hardship. And it covers things like treatments, rehab, preventative services, care access, all that kind of stuff without going into poverty because of it. And people not only need to live a healthy life, but a sustainable life. And this would also help that because many countries in Africa, their median age is in the mid 50s, and this would greatly heighten that number due to being able to get help. This issue is not only in third world countries, but it's also in the U.S. In fact, the U.S. is the only high-income country without universal health coverage, and about 8% of the population is uninsured. There's been some steps toward this in 2010 with the passing of the Affordable Health Care Act, which made healthcare more accessible and affordable. But however, there's still work to be made. Some healthcare executives are trying to insure people in their plans, but the problem is that they're not getting the financial stability back that they need to. So they're straining resources to try and bring individuals into their plans, but they're not getting as much money for it, so it's hard for them to keep lining out these services. And this relates big to health and wellness because if people can't afford what they need, they can't get the help they need. And many adults will go without getting checked for things like diabetes, cancer, cardiovascular disease. A lot of children will miss appointments for dental care, immunizations, and annual wellness checkups, which can help track like their developmental milestones, which can lead to poor health and wellness. Excuse me. And this can also greatly affect minority groups as they are the majority of the people uninsured, and this can help bring a little more equality to them and help them get and ensure that they get the successful treatment they need. Along with global awareness, this issue also affects justice as it shows that there's inequality in the healthcare system. And the U.S. Constitution states that we have unalienable rights of life, liberty, and pursuit of happiness, and this actively foregoes that right if we can't get the treatment we need because we can't afford it. So I think it is the government's job to ensure that everyone has access to and is able to access and afford the treatments they need. And this can also help the minority groups and low income families also get the help they need and the services that they need to live a healthy and sustainable life. Thank you.